Imagine a physical health condition that carries the exact same mortality risk as smoking up to 15 cigarettes every single day. This chart shows the specific physical toll of that condition. We are looking at a 29% higher risk of heart disease and a 32%. When genuine connection is absent, the brain goes on high alert, creating a psychological state that mimics social anxiety. Crowded rooms can actually backfire. They overwhelm a brain that is already actively scanning the environment for social danger. This animated flowchart shows what clinicians call the loneliness trap, a closed, self-perpetuating cognitive system. The cycle begins with social withdrawal. An individual feels disconnected, and as a result, they turn down a social invitation. Declining that invitation leads straight to the second node, a deeper state of physical and emotional isolation. While isolated, the individual enters a phase of hyper-analysis. They replay old conversations for hours, hunting for the exact moment they might have said the wrong thing. These negative assumptions create an intense fear of future interactions, making the next social invitation even harder to accept. Loneliness survives by tricking the brain into choosing isolation as a defense mechanism, ensuring the condition sustains itself. When researchers run meta-analyses on loneliness treatments, the results show that the most effective interventions avoid focusing on social opportunities or support groups. To resolve the condition, treatment targets maladaptive social cognitions. These are the automatic, negative assumptions a person makes about how others view them. Licensed clinicians use cognitive behavioral therapy, or CBT, along with behavioral activation. These evidence-based treatments directly break the mental circuit of isolation. Recovery requires clinically rewiring how we perceive social interactions before we can successfully participate in them. Because cognitive behavioral therapy requires a licensed professional, a lack of access to mental health care directly drives chronic loneliness. The danger is highest in rural areas, where the physical risk of isolation peaks and the density of clinical providers hits its lowest point. Coping and Healing Counseling, or CHC, addresses this geographical bottleneck by offering 100% HIPAA-compliant virtual therapy across all 159 Georgia counties. CHC also removes the financial barriers. They offer individual and group therapy with commercial plan coverage ranging from $10 to $40 a session and a $0 copay for Medicaid. The physical risks of the loneliness trap are severe, but the cycle can be broken. Relief comes from working with a professional to address the underlying patterns of thought.